Hello, hello, hello. I'm so excited. This is a great afternoon because I was anticipating you being here for a long time. So this is 2024,
Yeah.
and I'm Dr. Miriam Smith, the host for Empowering New Nurses. And I have someone special here by the name of Menz. You know what? He is a nurse, and although he's a nurse, he's an advanced practice nurse, and he will tell you a little more about himself. So first of all, I'm going to say thank you so much for coming on and for have accepted the invitation. I feel very blessed. And I know
Thanks for having
my
me.
audience is here. So I'm gonna ask you just tell us a little of your background before you continue this interview. This is the Empower New Nurses show. And I promised them initially that we'll have seasoned nurse like yourself, specialized nurse like yourself, and younger nurses who have just started the journey. So
Right.
please just go ahead. The floor is yours right now.
All right.
About yourself.
I initially I started in computers. I have a degree in computers, but I realized quickly that I did not want to work with machines. So I want to work with people and helping people. This is why I joined the field of nursing. And after completing my associate's degree, I worked for Montefiore Hospital, for
Mm.
about 8 years. Worked in their med surg department, then dialysis, then ICU, critical care, where I met Miriam, who guided me throughout my journey. As I was, she was sort of nurturing me as I was trying to spread my wings a little bit. She taught me my EKG courses and the how to titrate the drips, etc. I can't really list all of it. After that, I continue with my BSN and quickly, right after the BSN, I completed my family nurse practitioner, and then started working with a provider doing family care. Did some nursing home. After that, I moved to. After that, I went to urgent care, and I was working as a nurse practitioner at an urgent care that branch I opened up. So I had a lot of responsibilities. It was a little bit scary at first, but I had people that I was able to collaborate with. So they helped me in my journey. And now I work as a nurse practitioner, cardiology nurse practitioner, NYU in Long Island.
Great. I'm excited for you. This is what I love to see, the progress. You didn't stop at one point, and that's encouraging for all young nurses that
Yes.
you help them to advance. And during your period of, transitioning, what are some of the areas that you think you would encourage your young nurse? You were in med surg first, but you didn't stop there. You gained experience, wide experience. You were in dialysis. What is
Mhm.
that all about? For those who don't know in the audience, what is that about?
Which dialysis? Yeah,
Yeah.
dialysis is really it's a filtration process for the kidneys. Those whose kidneys are no longer able to do the work of filtration, where you turn waste products into urine, and this is extremely important. The kidney does so much that I can touch up on, but really, in a nutshell, it filters.
Great, great, thank you. But now you have specialized in the cardiac system,
Mhm.
that area of yours. So have you found any of the basic EKG that you learned when we were practicing and you had to do some strip reading, and have you found that any way beneficial or helpful to you as in working in this capacity now?
It's quintessential. he can't you can't you can't do cardiology and not understand those basic or be able to read those basic rhythm strips. It's your vehicle. It's really like it's like your bread and butter. So definitely, I
Great.
use it every day.
I'm excited for that. I'm excited because at first it had seemed challenging, wasn't it?
Yes.
It was. But after
Mhm.
you have understood the concept of it, wow.
Yes, yes, yes. And it eventually it evolves as
Yes.
you understand it more. It
Right.
takes on different shapes. It
Yes.
evolves and it starts to I guess tell you stories.
Yes. 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 I'm
Sort
so
of.
excited for that. So you have been in nursing for about how long now? How many
We'll
years?
say 10 years.
10 years. And you
Mhm.
have advanced quickly. That's great. So during this period, what are some of the changes that you yourself have observed in the healthcare system?
I've observed a lot of because a lot we're more electronic, so I've observed a lot of the older nurses are some are challenged, some accept the challenge. So they they have to embrace the electronic, and a lot of people look down upon electronic system. I myself do find some flaws in the sense that it does take away some patient care.
Mm-hmm.
But nonetheless, it sort of holds you responsible. You know, it gives you sort of like a structure if you use that as your a source of documenting. It reminds you what you need to do. So if you can prioritize your time correctly, then you can do both. You can fulfill the electronic and also do the patient care, fulfill that part as well.
I really appreciate that because we know that nursing is both, it has dual role there. It has the components or the dimensions of it. You
Yes.
think of the scientific research, and then you also think of that art, the clinical, where
Yeah.
you have to stretch yourself and be empathetic and be a part of that relationship that exists between the patient, the interprofessional team, and how we collaborate to make that care individualized for such patients.
Yes.
So I really appreciate that. And we have to embrace technology because this is the way it is now. In earlier my time, because I'm a baby boomer, and I can recall when I had to write my progress notes and write and write and write. Now, as you said, with the digital system, it's more structured,
Yes.
definitely more structured, and you can cover a lot in a short time. However, there's a
Mhm.
little disadvantage there. So because when the patient's looking at you and you're trying to record or you're trying to chart, they can
Yes.
be upset that you're paying more attention to them. But guess what? If
Exactly.
it's not
Exactly.
recorded, it's
It's
not
not
done.
done. Yeah.
It's not done. It's not done. So that's it. But you had a time in the COVID, and I know that we're not here for long, a few more minutes. But during your COVID experience, what was that like for you?
It was very stressful. At the same time, as a nurse, this was sort of like you're not necessarily a calling, but more of a duty. Being that you have your strength, you have certain skills. Especially during COVID, a lot of patients were critically ill, regardless the unit that they were at, or regardless it was med surg or not. So having the critical care experience really helped me provide care for patients during that time.
Wow, thank you. It was challenging for all of us because it was something unprecedented.
Unprecedented.
It was really, we all did get some beating from it. But thank God
Absolutely.
you're here and I'm here,
Yes,
many more.
yes.
So
By the
we can
grace of
tell a
God.
story. So,
Yes,
we have more than 8 billion individuals in this world today. And your story is important to motivate some young nurses
yes,
today.
yes.
So, I must say that I'm proud of you, and I
Thank you.
just wish you all the best as you go along. But I know that you were a part of I'm happy I met you. You were a part of my process, right? And
Yes, thank you.
as I educated others and educated myself, I've seen the growth. And I don't forget when I was doing my terminal degree, you referred me to somebody. So, there's never one person who has all the accolades or whatever they've accomplished and they've done it by themselves. So we
Yes,
should not never forget where we have been and people who have touched our lives during the process.
Absolutely.
And
Yes.
you have been one of those who touched my life. And I appreciate you.
And you as well. Thank you.
Okay. So, because I've been an educator for many years, and this is more than 4 decades I've been a nurse, I've come with my past experiences, and I've gained a lot more in the United States because, for your information, I was recruited here as a critical care nurse from Jamaica, West Indies in 1986, and that's a long time.
It is.
And I've shared and I've gained, I've gone to, um, I came here with my BSN, and then I went to Mercy University. I did my MSN, and then at Chamberlain, I did my doctoral in healthcare systems leadership. So, and
Amazing.
you have been instrumental in some ways without even realizing it, and
That's
I thank
great.
you. So after I retired
Yes.
recently,
Mhm.
I started doing a podcasting and YouTubing, and that helped me. My daughter and my mentors decided, why not put some of what you've been writing and reading and saying on the podcast? Why not put it in the book? And so I've been inspired. So here's my book, Nurse, the Guide to Empower New Nurses in Delivery of High Quality Care to All Patients. Let me hasten to say that the experiences I've gained, many of those experiences are written in here. And these experiences have helped me in my growth in nursing. Not everything is there, and it's not substituting for another book. This is some of my experiences that can help a young nurse or any nurse at all, because I've spoken to nurses who have said, Miriam, that was a reminder for this, and that was a reminder for that. So
Mhm.
I know you have obtained a copy for yourself. So I'm giving you the opportunity now to say a word or two that you have gleaned from this book or recalled from this book that you would want to pass on to our young nurses as we are coming to the close of this segment here.
Yes, yes. So, the humanistic part of nursing.
Yes.
So, as we go through our work and understand what it takes for our orders for the day,
Yes.
we want to focus that the patient is human, regardless the emotions that we have going on. We want to try to set it aside and be compassionate. That's one thing that you promote a lot: compassion and empathy toward patients, and view every patient as a human being, not just someone with hypertension or somebody with blood pressure, but more like Mrs. So and so, who happens to have hypertension, or Mr. So and so, who happens to have diabetes.
Thank you so much. Thank you so much. And as we're about to come to the end of this segment here, session, I just want
And
to
I'm so sorry, just
go
one more
ahead.
thing. More crucially, make sure you nurture the younger nurses that comes along. Not only is it rewarding, but at the same time, they will help you along the way as well.
Thanks for sharing that, because you know what? I have observed from my experiences that the baby boomers, uh, they are able to share certain information. The young nurses, they're more, most times, they are more savvy, computer savvy, and the collaboration and the working together can balance things. So
Exactly.
we learn from each other. And I've heard the statement before, nurses eat their youngs.
Mm-hmm.
And we must say, as nurses and the practitioners caring for others, we have a responsibility to pay it forward. Someone helped you, someone
Absolutely.
helped me, and
Mm-hmm.
it's our responsibility to help others as they grow. I went to a session in Texas last year, and it was exciting and at the same time a little challenging, because I've met people there who said, my sister was a nurse and they treated her so badly she came out of it. And some nurses that I've interviewed, they attested to that. So I'm just encouraging my senior nurses right here now. I know for sure there are not many who don't treat their young nurses badly, well, but we're encouraging all. And in addition to that, I'm encouraging my young nurses to advance themselves. There are
Yeah.
so many resources out there. Wouldn't you say that?
Oh, absolutely. It's crucial to continue to learn. Even you want to advance yourself because you're going to practice safer, and it's not enough to carry out tasks. You want to know why you're doing what it is you're carrying out, and you become that extra checkpoint because maybe the provider is being overworked, and you can either prevent something from happening, or you can suggest adding something to the treatment plan that can be very crucial and may even save the patient's life.
Thank you so much. And as I end now, I just want to say thanks to you and our patients and our nurses all to think of the different dimensions of self-care. Many
Absolutely.
times we forget about ourselves, but I noticed that the younger generation of nurses, they have come from a different perspective. They're making sure that they take care of themselves, and I would
Yes.
encourage the older ones to do just the same, because there are so many dimensions: the spiritual, the emotional, the social, and so forth. And as we collaborate in the care of our patient, the interprofessional team, we all, and as nurses, we're liaising to the other professionals. And it's important the patient trusts us in such a way. They'll tell you things sometimes what they'll never tell the doctor. And I've
Yes.
had that experience. And
Yes.
so when we get that information or those informations, we can able to pass it on, and then the care plan can be changed and the patient will receive professional, high quality nursing care. Mr.
Absolutely.
Mez, thank you so much for coming on. If you
Thanks
have a
for
word
having
or
me.
two to say to your last words to your nurses or to whoever, young
Well,
nurse, what would
to
you say?
to piggyback on that, self-care, just like the on the airplane, you want to make sure you put your oxygen on first before you can help others. So very nursing is can be labor intensive on your body. So you want to make sure that you care for yourself so that you can keep going.
Thank you so much. And in this book, I have tidbits, I have the dimensions of nursing, of self-care, which we all need. And so this book is on Amazon, and I know you obtained yours from Amazon, but they can
Yes.
also contact me and DM me and get their copy too. I am so excited that I'm a part of the process and I'm able to pass on some of my expertise to the generation of young nurses. So if there are nurses online who are looking, who have just graduated, or young nurses who haven't gained a lot of experience as that yet, there are tidbits in here, there are pearls, there are nuggets for you. Get your copy, get your
Yes,
copy.
please go get your copy, and this will save you a lot of this is years of experience that's in this book that will save you a lot of mistakes that you will not need to make.
Thank you so much. Thanks again for accepting the invitation, and I look forward to seeing you and some other male nurses. And although yesterday was Father's Day, I'm going to say happy belated Father's Day.
Thank
And keep up the good work
you.
with your family and your patients.
Thank you so much.
Thanks. Bye-bye.